Good morning, everyone. I am Angie Whitcomb. I'm president of the Shakopee Chamber, and I want to welcome you to week 2 of our brand new Shakopee Chamber podcast. We still don't have a catchy name for it, so it might just remain the Shakopee Chamber Podcast. But we designed this podcast to keep our members informed on issues that are important to them and that add value to their days and to their business. And while our original intent was not to build a COVID-19 podcast, holy cow, does that seem to be the only thing we can talk about these days, because it is the thing that is dominating and monopolizing all of our time, whether it's personal or in the workplace. And I'm really excited about our guest today, Erin Sexton from Mayo Clinic. But, we asked her to come on the show because we've been observing, as we talk to businesses, that as time goes on, information about this virus gets lost in the politics surrounding this virus. And that has left people confused, angry, in some cases more scared. But what I've noticed most recently is really divided. And we're going to touch on that today, Erin, primarily about, the mask debate. I mean, I feel like that is the core of all of the anarchy. So let me introduce you. Erin Sexton is the Director of Community Engagement for the Mayo Clinic. And we're really excited, Erin, to talk to you today about how you took a company, you and your team took a company as large as Mayo and transitioned it to a new normal and a safer environment for patients and staff, and give us some lessons on how all of our businesses can learn from your experiences and apply it to their own companies. And I have to say, Erin, a big thank you to you and your team. You've been talking to chamber execs across the state, you and your team, for weeks now, on all things COVID, including some updates on Mayo's medical trials and studies on drugs, and how we're going to get rid of this in addition to the prevention. So welcome, and thanks for being here today.
Well, Angie, thank you so much for having me, and thrilled to be here. And I think at Mayo Clinic, we really do see ourselves as a resource, not just for the communities we serve, but the state and region more broadly. So happy to be here and happy to share some information with you and your chamber members. And
great.
As you said, COVID's now been dominating our life for the last number of months. And,
yes.
It sort of feels like March when the switch flipped and everything kind of closed down. It feels almost like a lifetime ago. But, during that time, we've learned so much more about COVID and how to prevent its spread, and, things that we can do to really remain safe and what people's perceptions are. And, as we've really looked to reopen our practice back in May, after it had been, largely closed down for elective procedures and other things for, a month plus, we did a lot of research as Mayo Clinic does, in terms of understanding what our patients expected of us, and really what we needed to transform within our own walls to make sure that we could really safely take care of patients.
Yeah. And Erin, I find that really interesting because you're Mayo Clinic. And so you assume that when people walk into Mayo, you're already masked, you're already washing your hands. Yep. So was it a big transition for you, and how did your team respond?
It was, to an extent, right? Because, as we really looked at, okay, what do we need to do, one for our own staff, but to make sure our own staff are safe. We've now talked about things like PPE. I mean, whoever thought of what was PPE before March, right? I mean, who knew? And, so I think in terms of how are we sourcing and make sure our staff have appropriate, protective equipment for them to wear and taking care of our patients. When our staff are coming on back to campus, we require them to take their temperature twice a day. The types of things that you had to look at, what do we have to do different? In terms of our own staff, but then what do we have to do different as we let patients back in? And setting up screening stations and making sure that they're masking and making sure that we're taking their temperature as they come in, and what's our visitor policies. And, so all of those things that, we haven't had to have, really strict processes around before, we kind of had to flip that switch really quickly, in terms of how do we do this? And, I think it's one of those things where, we're having to do it as a healthcare institution, and your members are having to do it as they welcome customers back in. And, what does that mean? What's that customer experience, in the same way we had to think about what's that patient experience? And so, for an institution the size of Mayo, yeah, it's been an undertaking. And, I think it's very different for our staff to experience it, but it's different for our patients who are now coming back to the practice and the behaviors they're having to adapt to. And
Sure.
so it's I think we're all having to work through this together. And so I can talk a little bit, Angie, if you like, about some of, I think, the things that we've learned in terms of that patient experience, and some of those both positives and challenges that we've encountered. I think from a positive perspective, what we know so much more, right? At the beginning of this, it was hard because, we had challenges sourcing PPE. We had,
Sure.
Lack of understanding really in how the virus transmitted. We had, all of these questions. And I think competing information, which was, challenging for us as healthcare providers, but I think challenging to the public too, and really understanding,
Absolutely.
how do we tackle this?
Yeah.
So the good news is we know so much more. We know the things that will help slow the spread. We know things that we can put in place that can help people stay safe. So as we look to open our practice, we took comfort. I mean, that was a real positive. So we knew things that we could do to help give safety to our staff and our patients as we reopened.
Well, that's really the key, right? I mean,
right.
Yes, you think, okay, you're a medical facility, and we've got St. Francis Regional Medical Center right here in our town, and you assume that as a patient, you're a captive audience. You're going to go there. It's not the same freedom of choice as, am I going to a restaurant or not? Or am I going to go shopping in retail? If you need to go to the doctor, you go. But that's not the case. You guys were feeling it, the pressure of the client and the customer perception as much as anybody.
Right. And I'm sure St. Francis would tell you the same thing. One of the challenges we then had too was getting people to feel confident that they could come back. We had a lot of challenge with people who were in emergency healthcare situations not wanting to go to the emergency room.
That's scary.
We really had to shift some of that education to our patients to say, if you're if you're having a healthcare emergency, come in.
Yes.
we are ready to take care of you and have those things in place. Or even, the well child checks, or people getting their immunizations, or coming back for mammograms, whatever it might be, to really start to get that word out that we're open, we're here from you, we're here for you. Make sure you come to us if you need us, and take care of those healthcare needs. And so it was a real challenge, and continues to be a bit of a challenge for us. And again, I think this is not unique to Mayo, but for healthcare in general, and I think for businesses in general, in terms of are people feeling confident enough to come out and go shopping or come to a restaurant? And so I think we're all challenged with that right now, frankly.
Absolutely. So what were some of your key learnings and things you did at Mayo that could be applied across any industry? Because I think, we're seeing that certainly here in Shakopee, trying to get the word out as a chamber of, here's the preparedness plan template, and here's where, resources, and being a former Minnesota Chamber employee, they've been a great resource, as you can well imagine, and, in connecting companies who manufacture PPE or have sourcing for that, and getting it out to the businesses, not just healthcare, but the businesses who need it to be able to open up their own doors safely. So what are some of the learnings you guys saw that could be applied elsewhere?
Yeah. So, I think, it's so interesting because, right, perception is reality.
Totally.
And so I think we're all sort of trying to figure out what it is that helps give that comfort and that confidence for people to come back. And so, like I said, we did some research. We through our patient experience team, and really understanding what was it our patients wanted to see. And, as I thought about it, that's not really unique to us, right?
No.
I think, and so I think it's part of what's valuable in sharing. And, what people really want is that visible safety precautions. They want to see it and feel it, and be able to experience some of those safety measures you're putting in place. So they want to witness that active cleaning. So even, pulling out the Clorox wipes and wiping down your counters, and doing that when people can see that you're doing that, is a very visible thing you can do in that
Sure.
active cleaning. Having detailed signage, in your buildings and online about the sanitation measures you're taking. So be very upfront. If you have decals on your floor or just tape marks of X's for social distancing, those are visible things that you can do that are going to help people see that, what, this business is putting in place some good precautions.
They care about me.
They care about me. People want to see, and well, you mentioned masks and the debate around masks, but people want to see that. And so if you're masking, you're showing employees that are coming, or staff that are coming into your facilities that, it's that I care about you, and we're doing what we can to help keep you safe. And sanitizer, having
Huge.
sanitizer stations, having a thing of hand sanitizer on your counters. I think additionally, some of the things we had to think about, and this isn't the case for all businesses, but you think of waiting rooms where you have magazines or puzzles or things that people can touch and share, all gone. Those kind of things, just removing those and having sort of less things that multiple people can touch and handle. Sort of the thing is, touchless pay, or, what kind of things you're doing from that standpoint. So it's really those visible things that you can put in place. The other thing we really heard is that timely and clear communication. Again, it's fun. It sounds a little funny, but even as you're talking to your customers, verbalize what you're doing. And putting in and verbalize those things that you're putting in place. So they're hearing you communicate that to them. And again, whether it's signs or posters or letting people know, hey, here are the things that I have, and it's visible and you can see it. I think gives people that it's a sense of confidence.
For sure. I think it also helps to reinforce that behavior. If I walk into a restaurant and I show up there, or to a clinic and I show up there and none of this is really forefront in my brain, but then I see somebody doing it and just demonstrating it and talking me through why, when I go to the next place, it's probably going to resonate if I don't see it, or I may think differently in my own home or in our own workplace. I mean, even here at the Chamber, we're a relatively small building. There's 5 of us. We all have our own offices, so very easy to distance. And when we're in common areas, we mask. We've had our doors closed since March. And just been working virtually and taking phone calls. The mailman has to knock before we go get the mail, but we're ready to kind of lead the way on how we can do this safely. So even in our little office, we put a plexiglass on our front desk to protect Christy, who sits there. We've got a mask and hand sanitizing station in our vestibule. So you walk in and we've got a big sign, compliments of the Minnesota Chamber. Here's our rules, sanitize your hands, put your mask on, and then come on in. We're open for business, but let's just respect each other this much to be able to do it face to face. Well, half a face.
Yeah, half a face. Yeah. You can still see when people are smiling in their eyes. And
totally.
And that's something we're doing too in terms of, and the state guidance has been pretty clear on this too, is work from home if you can. And you'll see my beautiful background. This is not what my normal office looks like, but
it's too bad. It's very taken
over my daughter's art room and turned it back into my office. I think we're all adjusting to that in terms of this new reality that we're living in.
Yeah, absolutely. And, as businesses are allowed to open as a chamber, we toyed with that. Should we still be working remotely? But we need to be here for the members we serve. And if they're trying to open up, but it is, we're all thinking about this because it was kind of a struggle. And I sent my team down via Microsoft Teams and said, where's your comfort level? And 2 of them are still on furlough and we'll bring them back as the workload requires. But where's your comfort level? And if we do unlock the door and let the mailman come in, and we're a visitor center too, and we're in the middle of a beautiful city park, if people come in and want a map, we have to. I don't want to live my life like this until we have a solution for this problem. So but it had to be a unanimous team decision and comfort level. And I think that's what businesses are struggling to try to get to, is they're trying to make money, and especially the small businesses where everything is tied together. So the personal and there's no separation of personal and and professional. It's all or nothing. And so as they're trying to get back to some sort of normal and find that balance, and then you hear things on the news, masks work, masks don't work. And oh my God, on any day, on any channel, you hear a different story. So Erin, as an employee of Mayo who, knows a thing or two about this, the great mask debate, does it work? How effective is it? And you see cities mandating it, and then the cities right next to them not. So is that even going to work if some of us are doing it and some of us aren't? I mean, is it that's kind of the big question and the topic du jour at the coffee shop.
It is the topic du jour, but and I'll just back up to some of your earlier comments to it. I think what we're all trying to do is define our new normal.
Yeah.
Right. And what is it? It's what we know is we're going to be living with COVID for a while.
Mm-hmm.
And institutions like Mayo are working overtime and test development and research and all of the things that we can do to hopefully move us past COVID or find some ways to address COVID longer term. But for now, we know we're going to be living with it for a while.
Mm-hmm.
So what is that new normal?
Mm-hmm.
Right, our new normal is universal masking. So if you come into Mayo, our staff are masked, and you as a patient need to mask.
Mm-hmm.
And what our experience with masking has been is, we have seen the impacts of taking measures like universal masking and appropriate use of PPE and enhanced safety protocols and screenings and testing for our staff too. We've seen all of these really make our practice safer and allow us to stay open and continue to serve patients.
Mm-hmm.
And that's what we want to do. We are here to serve patients who need the expertise that Mayo Clinic can bring.
Mm-hmm.
So when we talk about our new normal, right, and we're dealing with the new normal now in our communities too. And, I think that new normal for all of us is, right, appropriate hand hygiene, washing our hands, masking. It does work. It helps prevent the spread. And, I think, as we look at it, it's not just about, me wearing a mask and preventing myself. It's me wearing a mask to prevent me from spreading it. If I'm asymptomatic, it's to prevent me from spreading it to others.
Mm-hmm.
And it's part of the challenge with COVID is people can be asymptomatic, not know they have it, and be out in our community spreading it. And that's where we're seeing now bigger increases in our younger populations who are wanting to get out and be social and enjoy life. And, I think we're now seeing that uptick in cases in that age group. And, while it might not, I think you do see people in that age group have pretty significant reactions, but it's who else can they spread it to?
That's
our challenge.
Yeah.
Mm-hmm.
And I think that's, I mentioned early on, like the more you hear about this, the more confusing it gets, because early on it was, this is just for old people and the people who are already sick. Yeah. Those are the people at risk. And young people who feel invincible anyway. I mean, I'm sure I did. Or my mother would tell you I did. They thought they were in the clear, and you'd see those, spring break shots from the beach in Florida, and you're thinking, oh my gosh, go home. Where are your parents? And so we told them, you're probably safe. So we not allowed, but it was kind of a free pass, right? And now we're like, oh my gosh, I guess it is for you. So now lock it down. And that confusion is, I think, where people start to think, okay, is this political? Is this medical? Where's the fine line? Or where is the line? It's not a fine line. It's a very distinct line, but it's confusing.
You bring up the question of communities mandating the use of masking.
Yeah.
And actually Rochester and Mankato, two of the communities we serve, both enacted policies last night.
Yep.
And so we are going to be, I think, tackling that within those communities. And, really where we speak to is from a public health perspective.
Yeah.
And so, we had an infectious disease physician talk to it last night at the Rochester City Council meeting. It's not about, is it political? Is it right? Is it left? Is it right? Is it wrong? It's here are the public health benefits.
Yes.
Here's how we've seen it benefit our practice and allow us to continue to serve patients. Here's what we now know about masking. And, what I'm happy to provide, and we'll share these with you, Angie, and feel free to share them with your members, is I pulled about 10 plus articles that Mayo has done on different types of safety measures, because you're right, there's so much confusion out there.
Yeah.
How do you properly wear a mask, right? I mean, you see people wearing
I have
them.
your list here.
There you go.
How do you wear them? How do you wash them?
How do you wear them? Do masks really work? And so these are resources that we have out there. They're shareable. It's just good information.
Yes.
I think when you're trying to cut through the clutter of the constant media, the constant back and forth, our social media, if these are resources that can be helpful to you, Angie, to your members, we're happy to share those and make them available to people. So
great. Thank you. And we will make those available. Erin, I do have a question for you. A couple as we wrap up here, but so on the topic of masks, some of the, myth and the rumor that's out there and the fear is that they do more harm. And people are talking about, oh, you're asphyxiating yourself or you're breathing in all this CO2. Yet healthcare professionals have been wearing them for,
right.
centuries, hours on end. Talk to me, help me dispel that myth, because you see just as much, if not more, of how they do good work and how they do stop the spread. I mean, I love the little petri dish examples you see happening. So talk to me about that myth of people saying that they're actually harming you.
Yeah, and I think there's another great graphic, and sort of this low, medium, and high risk for exposure, right? And where you're going to have that low risk of exposure, you have both people masked, standing, socially distanced. I mean, the risk of transmission at that point is, very small. One person masked, the other one not. More moderate, and so I think these kind of visuals that you're starting to see out there right now are really helpful, just in giving people that, okay, that makes sense. Just a low, medium, high. Skip percentages and numbers. Just here's what I need to know. And I think to your question around, do they do more harm than good? No, they don't. And I think there are exceptions that you'll see in a lot of these policies that are being put in place for people who do have some serious health conditions or disabilities.
Sure.
Or kids under 2. So you'll see those types of exceptions that come forth. But for you, for me, no. I mean, it's you are going to be better off wearing a mask and helping to slow the spread than not wearing one. Yeah. And I think as we look at our economy and trying to stay open, and we want, I love to go to restaurants and eat out with my family, and it's been, I want to see my kids be able to play baseball and sports and enjoy those things. It's heartbreaking to see, and we all look at it right from our own vantage points. But, for me, my son's team made it to the state Bantam hockey tournament, and 2 hours before they were going to take the ice, everything shuts down. Seniors going into, kids who didn't get their graduation, or, grandparents who can't see their grandkids. Our businesses and your members who are feeling this pain and the economic pressure, that COVID has placed on them. I mean, it's been devastating to business. And so, I think if there's things that we can all do to help keep our economy moving forward and open, those are things that I think we all want to do. And, and of course, wish your members the best, and glad that they have somebody like you, Angie, and the Minnesota Chamber, who are helping to represent them and bring good information, and hopefully this information's been helpful.
Yes, it's been great. And Erin, I absolutely appreciate your time. So one last question as we wrap up here. I see, we're almost right at 30 minutes. We're getting good at this for week 2. So, businesses. I think some of the information coming out has been overwhelming. It's like, oh my God, these preparedness plans. I mean, the template was multiple pages long. And when you're feeling the economic impact and you're maybe nervous about elderly parents or things going on the personal level, and it's all combining. And then, the chamber sends out, fill out this template and send it to us, and then put the sticker in your window. It's overwhelming, and that's easy to set aside. But so what are the 3 most important things that a business could do that would put them in a safer spot to create that right consumer perception, that comfort level of consumers coming in the door?
Yeah, I mean, I think again, go back to perception's reality.
Mm-hmm.
Make these things that you're putting in place visible.
Mm-hmm.
Show people what you're doing. I think these preparedness plans, they're great. They're tough, and we've seen a number of communities look at, okay, what can we do to help give our businesses that visibility?
Yeah.
I think I pulled a few examples, whether it's Red Wing or Northfield or Rochester, a number of communities that are saying, okay, here's what we collectively are agreeing to. And so I think the biggest things you can see are, what are those visible things you're putting in place?
Yeah.
Show people what you're doing.
Show them what you're doing.
Show them what you're doing. And, of course, back it up, but make it visible.
Yes. Yeah. That backing it up piece is critical. It's not enough to say we're doing it and then have no evidence of it. Right.
Yep.
So, well,
Erin, that's the biggest thing we've seen. So that's people want to see it.
Absolutely. Well, we appreciate your time, and thanks for all that Mayo is doing research-wise, and thanks for all the time that you and your colleagues are giving to chamber execs as we try to bring the most factual, relevant, digestible information to our members, because we will all get through this, but it's going to take some effort, and it's going to take tweaking our standard operating procedures. So, well, you continue to be well, and thank you again for joining us on week 2.
Well, absolutely. And I wish, thanks for having me. I wish you the best. I wish your members the best. We frequent Shakopee quite a bit and enjoy your businesses. So,
well, we appreciate
best wishes
that.
to you all.
Thank you so much, Erin.